Can still get started. I think this looks like everyone. Good morning, everyone. My name is Andrew Kantor. This presentation is about disability benefit claims with a focus on mental health related disability. So a little bit about me. Again, my name is Andrew Kantor. I'm a senior partner at the law firm of Kantor Kantor. We're an insurance law firm. What we do is sue insurance companies when they don't pay claims. We specialize in health and disability insurance. I like to brag about this whenever I have the chance. Just a few months ago, we won a big case in the Fifth Circuit against United Healthcare. If you want to look at it, Dwyer v. United Healthcare is one example of what we do. It was a case about United Healthcare refusing to pay for partial hospitalization for a young girl with eating disorder, with a severe eating disorder, and how awful everything they did after that was. So our specialty is disability litigation. We fight with insurance companies who don't pay short and long-term disability claims. That's all I've done basically for the last 10 or 15 years. A large portion of my clients are disabled primarily from mental health related issues. So this is a really important topic to me, and it's something I deal with a lot. So first I'll start with kind of the overall definition. The definition of disability, there's a few different sources of disability. I'll explain all of them, but in the most simplest terms, disability in this context means being unable to work despite reasonable accommodation. So no matter what accommodations you are given, you cannot do your job. There are a few main sources of disability benefits. The most common and popular is Social Security disability insurance. The next most common and popular is private short-term and long-term disability insurance through an insurance company. Another source for some people is workers' compensation. If you are injured on the job, meaning if in this case, if your mental health issues are in whole or in part caused by your work environment, not necessarily just a hostile work environment, maybe something you experience with clients, or if you're maybe a frontline worker or something like that, and you've had trauma as a result. Another source that is extremely important in California, which is not listed here, is California state disability. This is a system unlike any other state in the country, and it is really great. You can get up to $60,000 depending on your salary for 1 year if you're unable to do your job. There's only an 8-day waiting period. You can sign up online. And unlike pretty much every other source of disability, it is overfunded. So they actually, they pay claims. The biggest problem you can encounter in state disability is not meeting the deadline. So as soon as you become disabled, file that claim. So I'll talk about all the sources of disability benefits and how they're a little bit different. So SSDI is what we call Social Security disability. In order to be eligible, you have to expect to be disabled for at least a year. A lot of people think you have to actually be out for a year. That's not true. You just have to expect to be out for a year. You have to have worked in a job for a certain amount of time in a job covered by SSDI taxes. 95% of jobs are covered by SSDI taxes. If yours isn't, you will almost certainly know it because it is a unique situation. Your employer would explain that. If you're not sure, you should ask. You also have to meet the SSDI definition of disability, which in its simplest terms is the inability to work in any significant capacity. The technical definition according to Social Security is you have to be unable to do any substantial gainful activity, which can earn you $1,620 a month or more. So if you can do any kind of work earning $1,620 a month or more, you do not qualify for Social Security disability. The benefits you can get for Social Security, the maximum right now, it goes up a little bit every year, is $4,000 a month until at Social Security retirement age, or until Social Security retirement age. You get an extra 50%, so about $2,009 on top if you have dependents under the age of 18 who live with you. The claim process is to start is very simple. To get through it is less simple. To initiate the application, all you have to do is go online to ssa.gov. And start the online application. I admit I have not gone onto the website in a few months, and thus I have not seen it since the government budget cuts, but I presume from what I've heard from clients, it is the same streamlined process, at least to start. Then what will happen is that's your initial claim, and 95% of initial claims get denied almost automatically. Then you have to appeal. You have 60 days to appeal that denial. Once you initiate that process, what will happen is you'll undergo an SSA review. Meaning the Social Security Administration will review your claim. They will reach out to your doctors. They will collect medical information, and they will also likely send you to their own evaluations to see if they think you are disabled under their definition. The practical reality of Social Security disability is that it is extremely difficult to get approved. It has been difficult for many years. It's always been difficult, and it's just getting harder. Almost all claims are denied at the initial stage, and then appeals have traditionally taken between 2 to 4 years to complete. Now the estimate is looking closer to 3 to 6, mostly because of the more recent budget cuts and most recent cuts to the SSA, but also because there's not a lot of money going into these things in the first place. If your Social Security claim is denied, you should really consider hiring a Social Security attorney. The fees can be capped at a relatively low amount. And it's really hard to get one of these claims approved without getting a Social Security lawyer. The one upside of this whole system is that the older you are, the easier it is to get your claim approved. So the closer you are to Social Security retirement age, the easier it is to get paid. The downside of that, of course, is the younger you are, the harder it is to get paid. I am giving people a warning now. There is a new Social Security proposal, which basically the rules used to be, or right now, are that if you're between 50 and 60, they have special rules so that it's a little bit easier to get approved than if you are under 50. What they're trying to do is dispose of those rules and make it so if you're 50 to 60, you have to meet the same qualifications as anyone else, which would basically make it harder for anyone between 50 and 60 to get their Social Security claim paid. Yeah.
What about what about the kids
What about the kids?
that apply? Like I see a lot of the children
Applying for Social
for
Security.
yeah, they come in for Social Security, sends the children in because like the parents not able to work because the child is so impacted by whatever disability.
Oh, when they're caretaking disability. Yeah, that's a little bit of
Would
a.
apply on behalf of the child for their exercise, but would that be a better way? You know what I'm
Yeah, so if you're talking about SSI and an adult disability, or you're talking about a child being disabled,
the child being disabled, let's say.
that's a different process. That's through SSI. So it's a little bit different than this.
Than this.
Yeah.
Okay, thank
You still go to ssa.gov to start the application. Yes.
I have survived better
Okay.
because of my foster parents passing. Does that change every year?
That's a good question. I don't know. I have to look that up.
I've been told that it's not big with Social Security disability. That's why I was asking.
I really don't know if it changes I thought it was tied to a COLA the same way Social Security disability was, but I'd have to look that up to be sure. My email address at the end, if you want to email me, I'll remind you to give you the answer. Okay, so before I go on, so that's Social Security disability, basically. The best advice I have for people, if you're considering filing a claim and you're not sure what to do, there's lots of Social Security. I'm not one of them, but there's lots of Social Security lawyers out there who will give you a free consultation, answer questions for you, and some of them will even file a claim for you. So I look for one on Google with good reviews that's been doing it for a long time. So beyond Social Security disability is short-term and long-term disability. This is insurance coverage, usually offered through an employer, just like health insurance or life insurance or anything else. You can also purchase policies individually if you want to. Frankly, most people don't do this. It's usually for higher earners who are advised to do so by financial advisors, but you can definitely buy your own policies if you can't get one through your employer. One thing to pay attention to if you have short-term or long-term disability insurance, it was a great thing that health insurance abolished pre-existing condition limitations. It's a wonderful thing. This same abolition does not exist for long-term disability. So with long-term disability and short-term disability, they're still subject to pre-existing condition limitation, which means if you get your coverage, you have to wait, and you already have issues which eventually become disabling. You have to wait at least a year, sometimes 2, before you can file a claim and have it be paid. Otherwise, they'll deny it as being pre-existing. So the benefits that come with short-term and long-term disability, short-term disability usually lasts about 6 months, while LTD, long-term disability, lasts until Social Security retirement age, which is usually 67. You're usually entitled to about 60 to 70% of your salary, sometimes subject to a monthly maximum amount. If you have this coverage before you file a claim, you should check to see if it's taxable or not, because you want to be able to set it up so that it's not taxable, because getting 70% of your income untaxed is basically the same thing as getting your income. Getting 70% of your income and then having that taxed is a big hit. The Social Security or the long-term disability benefits you get will be reduced by other disability income, such as Social Security disability and state disability. And the policies vary a lot, but there's one main thing basically which guides them all. Is most policies will pay you for 2 years if you are unable to perform your own occupation, and only continue to pay you after that if you're unable to perform any occupation as the policy defines it. It doesn't actually mean any. So for example, if you were a lawyer making 500 grand a year, any occupation means a job you can be retrained to do, which can earn you as much as you're earning on disability. So if you were a lawyer and the only thing you do is be, a surveillance monitor earning, 1% of your income, that's not sufficient. If you were a nurse and they say you can be a nurse consultant over the phone, that's an argument they may make to try and deny your benefits after 2 years. Unfortunately, in this context, there's a much bigger problem after 2 years when it comes to long-term disability and mental health claims, is that most policies have a mental health limitation in it, which means that you can only get 2 years of benefits under your long-term disability policy if you're disabled for mental health limitation. This is first something that I would love to fix on an advocacy level. If anyone knows any senators or any congresspeople who want to figure out a way to ban these limitations, Vermont did it. Vermont does not allow mental health limitations in any of their policies. I'd love to do it with NAMI one day, but there's no other way to do it basically other than banning it. If you have a policy, you should look at it to read your mental health limitation. There are different kinds. They range from very strict to less strict. The most strict definition is they will call anything that is in the DSM-5. If your diagnosis is in the DSM-5, it is a mental health condition and you only get 2 years. For those who are familiar with the DSM-5, it includes things like Alzheimer's disease and mild cognitive impairment and lots of things that we wouldn't normally consider mental health issues, and they do this to try and limit the benefit. There are other limitation versions which basically say we define mental health limitations as conditions which are normally treated by a psychiatrist or therapist, including these 6 things. And it actually lists depression, anxiety. Those are pretty clear, but far less strict than the other version of the policies. If you are an employer in a position to purchase policies like this for your employer, I really request that you look at what you are offering your employees. I've done it for my own employees and try to offer them a policy without this. What ends up happening a lot is people with recurring mental health issues, when they're young and they want to stay with the same employer, they'll maybe go out and then exhaust their benefits and then have issues 3 or 4 years later and then be out of benefits. And if you're sick enough to not be able to work, but not ill enough to not qualify for Social Security disability, which most 35 to 40-year-olds are, you're left without any disability coverage. It's a really awful position for people to be in. I've seen it more times than I can count. So the claim process for long-term disability, you will fill out a claim statement basically explaining from your perspective why you're impaired. You will also have your doctor, your therapist, or psychiatrist fill out a statement also explaining why you're impaired. They will also request your medical records. Now, with any other disabling condition, any physical condition, they would just request your medical records and expect to receive them. When it comes to psychiatric and therapy records, they don't necessarily need the actual record. We all know that, if an insurance company is about to request all of our therapy records, some of it's related to disability, and then 90% of it is something I would never want an insurance company to see ever, especially if they're going to be assessing whether I can work or not. So what you can do to avoid that is ask your therapist or psychiatrist to write a summary letter explaining how many times you've seen them, what they've treated you for, what your disabilities are, and they can basically exclude all the personal non-relevant stuff. Insurance companies almost always accept this, and it's a really easy way to avoid any drama. One other thing is that I see insurance companies doing less and less in the mental health context is having you sent for an in-person examination by one of their psychiatrists. Social Security will do this all the time. You can pretty much expect Social Security to send you for an in-person exam. Long-term disability is not doing it anymore, really. What they're doing is having you assessed via paper peer reviews. So they're having someone read your medical records and then just decide you're not impaired. But if you are subject to an exam in person, it's my advice. It's really important to consider reaching out to a lawyer at that point, because in my experience, if they're sending you to an in-person exam, they're trying to deny you, because there's no reason they can't trust your therapist or your psychiatrist who are explaining what your conditions are. And if they're sending you to someone, they're looking for a reason to cut you off. So the practical reality for LTD.
Do attorneys accompany a person?
So that's a really good question. The attorneys are not usually allowed to accompany the person. What I usually recommend is asking them if you can either bring a family member with you or hire a legal nurse observer. So there are nurses you can hire whose jobs are to sit there and record what happens with the exam. The insurance company has a lot of control as to whether or not they allow it, but I sometimes welcome it. I ask them if they say no. If I ever get to go to trial and they're relying on this report, the report they wouldn't let anyone else in the room for. Yeah, sure. We're really that's really the report we're relying on. And it often it makes them look less credible. So they will sometimes they'll agree and say, okay, fine, we'll let someone in the room. So if you can ask, but what the important thing the lawyer can do if you're talking to them before the exam, One thing is assess your situation to actually see whether it's a setup for a denial or, oh, there's actually a reason to send you to an exam. Like maybe your doctor was unclear, or maybe there's not evidence. There's lots of real reasons to send you for an exam. The other thing they can do is look up the examiner. There are examiners, or there's a list of 15 people. If I see their name, I know exactly what the insurance company is doing. I know who they work for. And I know what they're trying to do to your claim, because that's all they do. Their job is to terminate claims. So that's one thing to consider if you're in that position. So the practical reality for LTD, most LTD is governed by ERISA because most of it's purchased through your employer. Just like your health insurance is governed by ERISA. I don't know how familiar you are all are with ERISA, but it's evil. It is one of the most evil laws that's ever been created. Lawyers agree, insurance companies agree because insurance companies love it. What ERISA does, unfortunately, is create a situation. Well, what the law does is make it so that if you sue an insurance company for denying your claim wrongfully, you can ask them for the money they owe you and maybe attorney's fees. It's pretty much the same thing as if the crime for robbing a bank was if you get caught having to pay the bank back with interest. What this means is that what's to stop an insurance company from just denying as many claims as they can and then seeing who appeals? And well, some might say that's a little bit hyperbolic because they don't deny all claims. The reality is insurance companies treat you like they're not worried about how they treat you. If they treat you poorly, they're not actually afraid of any repercussions. Nothing bad happens except maybe they have to pay extra money to a lawyer like me. And when they're denying 50 claims and 5 of them get litigated, that's okay for them. So what this does is it creates a system that's similar to what I'm sure you've all seen with health insurance. They pay what they have to. They don't pay anything they cannot pay, and they make the entire process as difficult as possible. And unfortunately, with health insurance, where there's individual things you can fight over and conquer, with long-term disability, they're fighting over your entire ability to work. So they're fighting over basically you and your status. So there's a few reasons mental health claims are specifically denied, and there's really important things to pay attention to if you're considering filing a mental health related disability claim. One is no psychiatry and or no psychiatric medications. Now, I'm absolutely not saying that you have to see a psychiatrist in order to be unable to work, or only people who are seeing a psychiatrist are severe enough. All I'm saying is that an insurance company will usually make the argument that if you are mentally impaired enough to not be able to work, you are also severe enough that you should be seeing a psychiatrist. There's ways to overcome that argument. If people see a psychiatrist and say there's nothing I can do for you, or your medication regimen is fine, or you shouldn't be on any medication, that's something you can use to explain it. But you should expect that to be seeing a psychiatrist if you want to get your disability claim paid based on mental health issues. If you're seeing a psychiatrist who's prescribing no psychiatric medications, I don't think there's a problem with that at all, because the psychiatrist is saying you don't need these medications, but you still need to see me. But no psychiatric medication and no psychiatrist, an insurance company will say, well, it's not to the point where it's not severe enough, basically. Another thing they'll often point to is no referral to higher levels of care, or no suggestions of referral for higher levels of care. Again, I certainly am not making the argument that if you're not referred to a higher level of care, like inpatient treatment or outpatient treatment, intensive outpatient, that all of a sudden that you're automatically able to work. You could absolutely be unable to work without needing this level of care. But it's something, again, insurance companies look to. What can make a big difference is even the discussion of it. If you're talking to your doctor and you say, if there's a plan for when you go to a higher level of care, or when you might need it, or what might trigger it, that's a really important thing to have, and kind of suggest that your situation is intense enough to warrant it, which lines up with your situation being intense enough that you're not able to work at that time. Again, you don't need to actually get a higher level of care, but it's important to at least talk to your doctor about it. Infrequent treatment is a argument insurance companies love to use, because it's subjective as to what infrequent really is. One person may need to see someone 3 times a week. The other person may, see someone once every 3 weeks. It really varies. But you can kind of expect that if you are in a situation where you're claiming not being able to work because of your disability, you should be seeing someone at least once a week, if possible, at least once every 2 weeks, and basically the more the better. Another thing is, if you have a provider that you can communicate with in between sessions, that's often fantastic. Someone you can email telling them what you're dealing with, ask them questions. So then the treatment is really happening all the time, not just confined to your session. And that's something an insurance company might expect to see if your situation's bad enough that you're not able to. Inconsistent activity. There should be air quotes here. I'm actually here. I can use air quotes. What insurance companies will call inconsistent activity is what they'll often use to try and deny a claim. They'll do this to all kinds of claims. This is their kind of bread and butter, the most stereotypical insurance company stuff. They'll see you walking around the block and say, well, you're walking around the block, so you should be able to do your job as an ER surgeon, right? Like, oh, you posted online that you're going out to dinner with your kids. Obviously, you can be a trauma surgeon despite all of your issues. They will throw anything they can at you. What really ends up, it's often a lot of fluff on their perspective. It doesn't actually do a lot of damage to the claim. What is actually problematic is them catching you being dishonest. So if you say, hey, I can't do my job as a lawyer because of my anxiety. I can still work out. I can still go on walks. I still hang out with my kids. I still take them out to dinner. Here's what I can't do. I can't write a brief. I can't respond to stress. I can't be in front of a judge. So if they see you walking around the block, being with your kids, going out to dinner, they can't say, oh, well, you lied to us and now you're not disabled. Now, if you say, I'm so bad, I can't leave the house, and they see you at Disneyland with your kids, yeah, that's a big problem. But what they call inconsistent activity is really only a problem if they catch you misrepresenting your disability, because from their perspective, if you misrepresent this, maybe you're misrepresenting everything, and they kind of throw out the whole claim. Yes. Oh, I saw you first, so you win.
So I'm curious about the inconsistent activity, sort of what it covers. I did in the past have a long-term disability claim denied based on the prudential investigator looked at my Instagram and saw that I had gone out to dinner with my wife and said that because I went out to dinner, I was not disabled. I met all of the other criteria.
Claims like yours are our bread and butter. I mean, did you appeal?
No, I didn't.
Bummer.
But,
well,
yeah.
Oh, I just want to so I should know this. I am not sure, and I think I know the answer to this, but does your office, you guys take on appeals? Yes.
90% of our work is pre-litigation appeals before, because that's when people need help. Yeah. So that's Prudential's bread and butter. Unfortunately, this is really something we see all the time. What I almost could have promised you is that if I would have looked at your records, there would have probably been acknowledgments telling your doctor that you were going out to dinner or explaining that. And they love to, we call it cherry picking. That's kind of what they do, is they cherry pick things here and there. If it's been 6 months since the denial, you can still appeal.
Okay, but my question is for the inconsistent activities.
Yeah.
What would you advise people who are in the process of applying for long-term disability? Would you advise making their social media private or sort of limiting like any public exposure? Because I was shocked to learn that they even looked at people's social media in the process.
There's a program called Firefly, I think it is, or they use something way more intense. They will put your name in and they'll scour all of your social media. They'll get it all on a snap. They'll get a report. They'll get everything. They use social media way more than they use physical surveillance these days. Everyone's claim will get looked at via surveillance or via social media. Different lawyers have different approaches. Some of the older school lawyers will say, just delete all your social media. Just delete it. Don't worry about it. Don't do anything. And, first of all, I can't trust my clients to do that, because even if they try, they don't always remember things. And you know what? Like these days, social media is such a big part of how people interact with their world and their friends. And I'm not as comfortable giving that advice. Now, to every client, we send a social media letter basically saying everything you do on social media, assume an insurance company is going to see it. Thus, if you're doing stuff, don't stop doing stuff necessarily. Just make sure what you're doing is what you tell your doctor you're doing and what you tell the insurance company you're doing. Because if those things are inconsistent, the idea that, you can work because you went out to dinner with your wife, like that's an argument we see all the time. It's really surface level stuff like that. And, that's what they throw at people.
So I have a client who is waiting for her appeal decision. It should come sometime in the next couple of months. If she is denied, is that something that I can refer out to you guys?
Certainly.
Okay, great.
Okay. Absolutely. Yeah.
Just reflecting to what she's saying, I gone through helping people that's denial. When we go out in small group, that's called support group. If I am deeply depressed, my people come around and help me to go out into the community and get some social interaction. That's why you have to appeal. I mean, they intimidate you that you don't put forward your support.
Yep.
May not be medication, but like NAMI and SHARE, they provide 24-hour support group. Those are the support that an emotionally injured person needs. So you have to articulate that is a therapeutic group I'm going to. And people are spending money for me. You better reimburse it. I'm a registered nurse myself. Earlier we were talking about suicide. I have a lot of physicians. Every day there's 2 physicians commit suicide and nobody knows, including healthcare. It's time for us as humans that care for each other's overloading and overwhelming to speak up against this money-making insurance.
You're here. Hey, I hear you. Yeah.
Oh, everybody, believe that it's just, you're lying.
I'll say you are
And
very.
attorney.
That help, yeah.
Yeah, well, I'll say you are very right. I'll also say that I have seen more than one case where the insurance company said you are able to attend support groups, so you are able to work. I've seen. One of my subspecialties is also chronic fatigue syndrome and long COVID cases, and one of the things they love to say is you're able to do self-care and attend your doctor's visits, so you should be able to hold down a full-time job. And it's like if you're up against logic like that, what are you really supposed to do other than just expect?
It's responsibility.
It's responsibility, it's stress,
Support group
reliability.
is not responsibility. You can always say, hey, I have to go home. I can handle
If we ever do a video commercial, I might call you. If we ever do Dodger, commercials during the Dodger games, we had a competitor do that once. That's my.
Her agent, she is not cheap.
Oh, okay, well.
Because I've been in emergency room critical care for 45 years as a registered nurse and during high risk obstetric. That level of stress has composed me.
Yeah.
And when I was being injured, I have nobody to turn to. Nobody. And being Asian, being Chinese, everybody expects you to suck it up and bury yourself. But because of my training, I could not let the whole community be sucked up by insurance money.
Good for you.
Yeah.
So I developed support group. I go to Madonna and I ask anybody who said I give them $1 coffee and we sit down. That's how I developed support group in a day. 7 volunteers will talk to you within an hour.
Wow.
Within your local community versus depending on company, a big giant to support and care for you. Each one of us have a local community.
Yeah.
So that's our mobile team. I
appreciate
founded that charity just to help.
We should talk after. I appreciate that. So a few other things. If you are, I think running out of time. So if you are denied, if you have a long-term disability claim or short-term disability claim that's denied, there's a few things to do. Request a copy of your claim file in writing. Insurance companies are required to give you a copy of your entire file, which includes everything you've submitted to them, but more importantly, all of the behind-the-scenes medical decisions they've made, which you need your doctors to respond to and explain. It'll contain the fundamentals of why they denied the claim, including all this silly logic that we've talked about previously. If you are given a deadline in the denial letter, it is extraordinarily important to appeal it. The law is horrible in this area where if you don't appeal the denial within 6 months, you often waive your right to sue altogether. There are a few policies which have some language that I like to argue about here and there. That they shouldn't have to do it, but the reality is appeal within the 6 months if you get that deadline.
Wait, so if the person who doesn't have a lawyer yet just wants to scribble on a piece of paper, I'm appealing, would that suffice?
Yes.
To get it?
Yep. Yeah, anything in writing which says I appeal is fine within the 6 months. I actually recommend saying, give me a copy of my claim file. Also, I'm appealing. But don't start the review until I give you all my evidence, just to make sure that the deadline is met. There's actually one case that came out recently where a judge has become skeptical of that 6 month scheme, because basically the 6 month rule was created by a bunch of judges a while ago, and then a bunch of other judges thought it was the law and then built on it. And all of a sudden there's 15 cases out there that says you have to file within 6 months because ERISA says so, when ERISA doesn't actually say so. And that's a really hard argument to make in front of judges, basically saying all of you morons were wrong for the past 20 years. Look at the law. They don't like that. Very much. So if you're denied or you think you might be denied, it's definitely worth a free consultation with a long-term disability lawyer. I am one. There are a lot of good ones out there. The consultation should be free. This is my advice for all lawyers. There's almost never a lawyer who's worth paying for before they're willing to speak to you for free, so they can at least assess that you're in their office for the right reason. you almost never want a disability lawyer to take your case on an hourly basis because you don't actually know if they think you can win. They could end up charging you hourly and then, oh, I always thought you were going to lose, but now you owe me $45,000 and you have no disability benefits. So free consultations are great. Again, yeah, there really are a lot of them out there. If you're looking for a lawyer for any reason independently, what I recommend is ignore the super lawyers stuff and the best lawyers. It's mostly marketing. We are super lawyers and best lawyers, but it's mostly marketing because other lawyers think we're not as good if we don't have. It's really a lawyer lawyer arrogance thing. And look for Google reviews and look for a long history of them. Like, you can't really fake Google reviews. Lawyers can't buy them legally. Maybe some do, but for the most part, if a lawyer's been doing a job for a long time and they have a long history of happy clients, they're probably pretty decent. And talk to more than one. Always talk to more than one. So if you're in a position where you cannot work and you cannot continue to work, and you're considering filing a disability claim, so if possible, ask for accommodation. I know it is not always possible. The type of disabling issues that can arise, are extraordinarily varied. Some people just have to go out immediately. Some people it's a slower process, and there are accommodations that can work. Even if your employer says no, at least you can then tell the insurance company, hey, I tried the accommodations and the employer said no. It preempts the insurance company from saying, hey, if you had just asked for accommodations, they would have given them to you. Right. It shows your willingness to do it and be accommodated. Make sure before you file your claim that your doctor's supportive and that documents that support in your medical records or in a letter of support. No matter how bad your situation is, it is impossible to get a claim paid without a physician support. Therapist or psychiatrist, both is ideal. And the support has to be ongoing. They can't just kind of sign off once and then you're done. You could expect them to have to check in basically every 3 to 6 months at least. If your doctor will not support your disability, your therapist or psychiatrist will not fill out the forms or believes you should be working when you don't believe you should, the only advice I have is to strongly consider finding another doctor. I don't think I've ever seen a client convince their doctor of anything. So it's better to just find someone else who will be supportive. The other thing, make sure if you're considering this, make sure you're telling your therapist and your psychiatrist everything. I know how hard that can be, even if you trust your therapist or psychiatrist immensely. There are always things that are hard to talk about. Ironically, those are usually the things you need to be talking about the most. Things like suicidal ideation, things like intrusive thoughts, which you don't think you can control, hallucinations, like the things that would scare me potentially to talk to my therapist about. Those are often the things that might, actually convince them that you're not able to work. And I say this to at least 70% of my clients because I see them all doing it. Don't be a superhero. Don't downplay your concerns. We all have a tendency to do that. I think it's the human condition, maybe an American condition. I'm not sure. It's a very bootstrap thing we all do. But try not to downplay your concerns when you're talking to your doctors. So that's my presentation. If anyone has any other questions, I'm happy to take them. Otherwise,
I have one last question. You don't have to answer it, but I work with CBEST a lot.
Who?
CBEST.
CBEST.
Yeah. I would like to know your thoughts about CBEST.
I have to know what CBEST is.
Okay. Yeah. They're essentially a state agency and they handle disability aids. And so what they do is they reach out to legal orgs and they transfer cases on behalf of clients. So it's an acronym for Countywide Benefits Entitlement Services Team. And I think they can be a bit controversial. At least I've heard some, unsavory stories. Yeah.
Well, my opinion is I know nothing.
Okay.
So
Okay.
hey, sweet, that's easy. Yes.
If someone hasn't worked, but now they're unable to work, can you get government funded disability?
How long have they not worked?
Year?
Yes, probably. It's the Social Security disability.
Maybe a year and a half.
So the Social Security disability formula is pretty generous in that regard. I think if you've worked if you've earned enough credits over the last, 10 years, you should still be eligible. The only way to know is to apply. Other than that, I don't. Yes.
I'm on EBT,
Hmm?
which is another entity. I know you probably don't know about much, but I know when the government shut down and EBT is gonna be affected. How will that help families that's on EBT during that time?
Talk about questions I can't answer. I don't know.
Emergency funding, there's emergency funding, like
Yeah.
$200. Emergency funding in the community.
Yeah, 'cause
Emergency.
Yeah.
because like I'm on EBT.
Yeah.
And if you really are emergency, you have no food, there is a grant, a funding called emergency funding. It's in the community.
I need to be.
Yeah. Sorry, if I may, I just want to piggyback on that. So right now, because of, what's going on in terms of like the immigration rates and things like that, a lot of people have lost, income. And, I would suggest, if I may, reaching out to just like the local authorities, I think their ambassadors doing, some work, may or may not be doing some work on that, just like local, I've heard about family centers that also may be helpful. Food banks, things like that. So like I think the local authorities are doing, maybe doing some work around that.
But the other thing
Yes.
is, you say California just sued to the Trump administration to get the SNAP benefits reinstated. So there
We'll
may
see.
be waiting to help it.
Yes.
My daughter was denied, so she's schizoaffective. But before the disease manifested itself, she worked, maybe 15 years, so she had Social Security. They denied her, so she's reapplied. And she's been in and out of treatment centers maybe 3 times. The last day was 7 weeks, and she was denied Social Security. So if she has no income other than SNAP and some other things, is she penalized? One attorney told her she'd be penalized because, of course, I help support her dad and I, because she has, no income. And is she also going to be penalized because she has property? Like I said before the onset of this, she's a professional. So she's not able to work, but she's being penalized on different fronts. So do you have some advice for that?
Yeah, so that's a really important question. Thank you. So I think what you're talking about are as far as the income requirements for SSI or supplemental. So Social Security disability insurance is actually separate from SSI and does not have an income requirement. So basically, everyone's entitled to SSDI if you pay the taxes, regardless of how much money you have. SSI, you can only get if you have under a certain amount of income. And that is unfortunately a little bit out of my area of expertise. But if you've talked to a Social Security lawyer specifically, they're the ones who would know. And unfortunately, my understanding of the rules are that the lawyer is right. That basically, if you give your daughter certain assets, that goes towards the income threshold, and then they can't get the SSI themselves. I think theoretically, the reason the system is set up is that so only people who don't have parents like you, really, who don't have any sources of income can get the benefit. I don't think it should be that way. I think we should have a much more robust system for social benefits, but I think that's kind of how it's set up right now.
So she can only go SSDI.
It sounds like it. It sounds like it. Yeah.
Is there any reason why you didn't talk much about the California SDI? Just timing or?
A few things. One is that it is outside of my area of expertise because I don't handle the claims. 2 is because I rarely hear of them being denied. Most of the time when someone tells me or someone comes to me with a disability claim, Social Security has been denied, long-term disability is denied, California state disability has been approved. So there's just not much to discuss because I don't know that much about it. One thing I will reiterate is state disability has a much stricter rule set up about the timeline. So, for example, if your claim is denied, you have 60 days to appeal. And if you miss that window, they can pretty much throw out your entire appeal. I don't exactly know why it's set up that way, but that's the way it's set up. The certifications are simpler than Social Security. The actual documents you need to fill out. From what I understand, from what I recall, it's very straightforward. It could all be done online. If you get state disability and then social security disability, the amount of social security disability will be reduced by a bit to offset what you get for state disability. If you have any other questions about it, I can try and answer, but that's pretty much all I know at that point.
You know, the last time, the only thing that happened was for my son, the psychiatrist said, I usually only support you getting SDI if you go into a program, like a outpatient program or something. And now that I'm hearing all this, I realize that was ridiculous, because that wasn't the issue. He'd been to one. He's like, I don't need to go again, but he needed some time to recover from.
Yeah, let's put it this way.
So get a new psychiatrist.
Yeah, you know, I can't say, you know, if an insurance company made that argument and said, oh, he's not in a treatment center, so he obviously can work, I would eat that for dinner.
Right.
That would be a great argument.
Right.
So yeah, I would try it.
Yeah, that was, okay, I'm learning.
Yes.
Okay, so again, just about the SSDI and the points, let's call it points, I don't know what you call it, work credits.
Mhm.
Yeah. It doesn't matter how long ago someone had accrued those work credits. For example, what if somebody worked for themselves? You know, another way that people who are disabled, they'll do gig work or self-employment or something like that. And they may have had work a long time ago.
So there's something called the 40-20 rule, where you have to have a certain amount of course, I could look this up. There's a certain amount of work credits you have to have. 4 credits. And I think one credit is 3 months of.
Correct.
Right.
Yeah. Full credit. Basically, right now, I'm working with low income group. If the person make around $5,000 a year, that equal to 4 credit. And then for a lot of people doesn't understand, you can back file your tax.
Mm-hmm.
Talk to your accountant. If you recognize you have a lot of self-employed people, don't file tax, you know, they take cash.
Yeah.
But you know, when they are confronted with the issue, when they talk to me, talk to your accountant. You can back file the tax to reclaim the 4-point credit to make it 10 years.
Like the 5,000 is the gross income or 5,000
Gross,
taxes
gross,
paid?
gross. So it's around, you know, $400 a month or 300 something, you know. I mean, each year is different, but lately, 2025 is around 4,500 per year. So the individual make around $400 a month. How can anybody make live on that, you know? But that's how the Social Security calculate your tax credit. But that will give you 4 points.
Yes.
Oh,
No, go ahead.
I was just wondering, I haven't heard of California state disability, I don't think. What exactly is it? Is it something you pay into or what?
Yeah, I'm pretty sure you pay in through your state taxes. I don't know too many details, but it's a pretty.
It comes out of your paycheck.
Look at
Yeah,
the W-2.
Yeah, it comes out of your paycheck. I think you're qualified pretty quickly after you start paying into it. There's not the same rules with Social Security you have to pay in for a while. I think as soon as you have a job, really, in California, you're eligible for it. Well, thankfully you haven't heard about it because you haven't needed it, which is a good thing. You know, I hadn't heard about it until I started doing this work. Anyways, but it can all be done online. It's through the same portal as you get unemployment benefits. It's the EDD California website.
So the employer has to opt in for California.
No, I don't think you have a choice. I am an employer, and you get audited if you don't.
You-
You can, the employer can provide
A voluntary.
So I was for UC, they have a separate SDI program that is not state, but you have to provide some form.
Yeah.
Additional.
No. Either or. Either or. So if you have one, like if you have short-term disability and you get California state disability, the California state disability will knock off what you get from short-term. So short-term disability in California is kind of worthless because normally state disability eats it up. But every other state, it's really important to have because they don't offer the same thing. So my contact info is up here if anyone wants to jot it down. Our website, and you know, I'm on Reddit sometimes if anyone wants to hit me up. But yeah, if anyone has any questions.
Your physical office.
Oh, it's not up there. Wow, it's in Northridge, near the Northridge Mall. It's 9301 Corbin. But I think there's 3 people in the office right now, and then 45 other of us are all remote. We go in, once every few weeks to meet up, but for the most part, we're remote at this point. And if you go to our website, there's a lot of, it's a link to our YouTube channel and all of our resources and stuff. Like there's a bunch of videos I have up there about, a lot of them are about mental health claims and different nuances and stuff. So if anyone finds that interesting, feel free.
Do you work in Northern California too, or just?
Oh yeah, we're all over California. We're in a lot of other states too, but mostly definitely California. We love Northern California. The judges are great up there. So that's it. Thank you all for your time. I really appreciate it. And have a great rest of your conference.
Thank you.